talking about, if you have not heard, Karl-Anthony Towns just released a video on his social media talking about how his mom was just placed into a medically induced coma, presumably due to coronavirus. That hasn't been confirmed, but that's the thought process given the symptoms she had and what's going on right now. That's what's hanging on them. So in this video, I thought it'd be important to talk to you guys about what this means, what happened in this case, what this means for you, and what you can do to protect yourself going forward. So let's get into it, guys.
But stop making excuses, stop whining, stop, right? Get at it. No excuses, just dominate.
Brittany, good morning, what up? All right, Abdullah, what up? Okay, so we were talking about CAT and the medically induced coma. I'm going to abbreviate it MIC. Okay, so MI, coma. So for everyone to start with, in the situation, what Karl-Anthony Towns is reporting is that his mom had a bunch of symptoms, was feeling short of breath, was consistent with what people are saying coronavirus symptoms are. His dad was also experiencing the same symptoms. They went in to get tested. The dad was tested, was sent home to self-quarantine. Mom was kept in the hospital because her symptoms were worse. And she continued to worsen, continued to have more and more respiratory issues, shortness of breath, difficulty breathing, and the decision was made to put her into a medically induced coma. And while that sounds crazy, the first thing I want to say is that people use medically induced coma for a whole spectrum of things. And so when we think of medically induced coma, people think it means one thing, but it's really this whole spectrum of seriousness. So to say that every medically induced coma is the same isn't exactly accurate. And I'm going to switch pens because I don't like how that one's looking. So it's not always the same. So we have this whole spectrum of medically induced coma. And as an anesthesiologist myself, I do medically induced comas all the time. And in this case, medically induced coma, the real definition what people are talking about is not actually anesthesia, it's not actually sedation. And what they're talking about is a medically induced brain deep sleep and brain suppression in the interest of preserving brain tissue that has been injured, / preventing brain and neurologic swelling as a secondary consequence of brain injury and brain malfunction. And what this is that we have a big brain in our heads, and I'm an artist if you guys didn't know. This is your brain. That's pretty good. I'm actually pretty good with the... That's a pretty good brain right there. You guys give me credit for that, right? We have a brain, and this brain is supplied. There's blood coming in, and then we have blood that drains out of our brain. And for every tissue in our body, we have a supply and demand issue. So the same thing with heart attacks, with strokes. Every tissue needs a certain amount of blood, needs a certain amount of stuff to survive, to metabolize, sugar, et cetera, et cetera. And we like to keep it exactly even, right? We want to keep enough nutrients going in, enough blood flow going in, and enough nutrients and waste and blood going out. And when things are in disequilibrium, they're not equal, you get problems, right? Like congestion, like your toilet. The fluid goes into the toilet and it can't come out, and you get a clog, you get overflow, it's bad news. And it's the same thing with your brain. And largely the brain flow to the brain, the blood flow to the brain is controlled by the metabolism of the brain. So the more active the brain is, the more blood will flow into the brain, and therefore the more swelling you will get on the brain if it's very active. So when you have people who have traumatic brain injuries, you have people who've had a stroke, you've had people who had some sort of insult to their brain, it is important to give that brain time to rest, both so we can direct our resources towards healing the brain, but also to reduce the metabolic rate of the brain such that we don't cause a bunch of blood to go into the brain and have the brain swell against the skull. And that would be bad, right? No one wants to be put in a small package. And that would be what we're doing to our brain. So a typical medically induced coma, we give a bunch of medications to make the brain what's called burst suppressed. So we put it as the deepest form of the brain is completely knocked out, is doing basically nothing. And we do that in an attempt, like I said, to reduce the demand of the brain because supply may not be there, / we also do it to reduce the blood flow into the brain to prevent swelling, which can cause a problem because there's nowhere for the brain to go but to bad places. Does that make sense to everybody? So that's the traditional medically induced coma, and that's over here. So we have brain injury. That's bad news bears, right? Then we have a whole spectrum over here that's serious, that are not so serious and actually secondary and actually are not really medically induced coma, but more anesthesia, deep sedation, or sedation. In this case, Karl-Anthony Towns' mom was having respiratory symptoms. So she was having shortness of breath, she was having lung problems. And so what doctors made the decision to do was to support her breathing. So she went from someone who came in, was having respiratory symptoms, having respiratory problems, to being, it was much more difficult for her to sustain herself with her lungs and her respiratory system. So she was in respiratory distress. And then it seemed like she went into respiratory failure, meaning that her ability to breathe on her own was not sufficient to meet the demands of her body. So she was not able to breathe effectively, oxygen effectively, and so she needed help. So the help that we provide is a whole spectrum of airway stuff. We're not going to talk about that. But the ultimate airway intervention is to put a breathing tube in, an endotracheal tube, ET tube as we call it. You put this tube in to the patient, in their mouth, into their throat, and into their trachea, which supplies the lungs, okay? And if you could imagine having a big piece of plastic shoved into your throat and into your lungs, it is not comfortable at all, right? No one would want that. Like, oh yeah, put that tube in my throat, right? Like a sword swallower. We don't want it. So we put this tube in. It's very uncomfortable for the patient. So in order to make the patient tolerate it, we provide sedation, either deep sedation or light sedation, because that makes the patient unresponsive to the intervention. So the whole point of the coma is nothing with the brain, but it's to allow the patient to tolerate having a breathing tube in to support their lung dysfunction. As an anesthesiologist, technically, if we're going to be loose with the definition, I perform medically induced comas every single day, because my job as an anesthesiologist is to bring a patient into the operating room, whether they're having a knee or a bunion or whatever. It's my job to bring them in the operating room, put them to sleep, put their brain to sleep, put them in a coma technically, right, to make them unresponsive to tolerate both my breathing tube, but then also the surgical procedure. So that's technically the way people are using it, the medically induced coma. And in this case, that's more of what we're talking about, is that Karl-Anthony Towns' mom was not having brain dysfunction, was not having any reason neurologically to have a medically induced coma. She was in a situation where she's having respiratory failure, and so to help her, they intubated her, put a tube in, and put her on a ventilator. And so, again, the tube is uncomfortable, and then the ventilator, pushing lots of air, is very uncomfortable. And so we sedate these patients. And it can be a deep sedation, a light sedation. Actually, sometimes what we'll do with patients, we give them a little anesthesia kind of vacation where we reduce their sedation, make it very light, and they can even write. They can have the tube in, they can't talk, but they can write on a piece of paper to talk to their family, communicate. They can be awake, they can be in the room with their family engaging. So it's a range of things. And so what you're going to see with coronavirus is a lot of people coming out saying my relative's in a medically induced coma, and it's not exactly accurate. What's happening is they're in respiratory failure due to their interstitial pneumonia or whatever their respiratory condition is associated with coronavirus, and they need help breathing. So to help them breathe, we put them to sleep, put a tube in, and we breathe for them. And so it's a little bit different than what people typically think is medically induced coma. And so for you guys, I think what's going to be interesting is we never take things seriously until things start happening. And so when we talk about social distancing and why it's important for everyone, even if you're young and you technically, based on what we understand, and we don't understand everything, based on what we understand, young people are not as at risk as older people. The problem is that because young people are asymptomatic, you may be infected and not know at all. And then you go over to visit your grandparents, or you go over to visit your parents, or you go over to visit someone who has a young child, and next thing you know, now they're infected, now they're in the hospital, they're on the ventilator, and you're like, wow, that sucks, they're old, when you're the one who did that. So for all the people who are out here, and they're crowding the bars, and they're spreading this around like wildfire, as you guys saw, the people in Florida, and we're not really testing a whole lot, but a bunch of people who were down in Florida spring breaking tested positive already for coronavirus. So now you have all these people who are going, congregating in these large groups, spreading it like wildfire, and then going back to their hometowns and giving it to all their loved ones. So for your guys' sake, the reason we social distance is not for you necessarily, but it could be you. You never know. There are young people who are getting infected, but you're doing it because you care about your parents, you care about your kids, you care about the old people in your community, you care about all these people who you see who are at risk, the immunocompromised young people who have syndromes, who have issues that would put them at risk. You're social distancing because you care, right? You're socially conscious and aware. And if you guys are not social distancing, if you guys are not taking precautions, washing your hands and taking this seriously, then you guys are not socially responsible. That's what we're saying. So all you guys think you're so, hip and, oh, I'm going to express myself and I'm going to go out and I have my rights, and you're so informed, that's ignorance. Recognize that every major medical professional in America is telling you that coronavirus, we don't know how severe it is. So when you hear people say, you know what, this is just like the flu, it could very well be. But my whole thing is, it's just kind of like when I talk about admissions with you guys, is I don't want to prepare for the best case scenario. I'd rather plan for the worst case scenario and have things turn out better than I thought. Wouldn't that make sense? I don't know, maybe it's just me. Wouldn't it make sense if we're not sure what this is all about, if we treated it like it was the most serious thing ever, and then we were like, we dodged a bullet, it was just the flu. Versus we didn't take it seriously, next thing we know, we got like World War Z popping off. Everybody agree with that? So when you hear this story, the important thing for you guys to recognize is you're going to see a lot more stories like this of people whose parents had a little bit of symptoms, and next thing you know, they're in the ICU, they're intubated, they're ventilated, they're asleep, they're unresponsive. And the important thing to recognize is that it's a respiratory consequence secondary to coronavirus, and the biggest thing you can do to protect yourself and protect your family is to practice good hygiene, hand hygiene, cough hygiene, in the crease, right? And then also to keep your distance from other people so you don't spread it super fast. Because the issue we run into, and this is actually really why we're talking about people flatten the curve, is that we have very limited ventilators. And you see in this case, this person needed a ventilator. Well, what if your parents need a ventilator and we are out of ventilators because we allowed everyone to get infected all at once? It's a problem. I think the other thing that's important to highlight in this is that a lot of people say, oh, it won't happen to me because I'm wealthy, because I have health care, because I have whatever. Here you have an NBA player, right, who's got millions upon millions of dollars. I think his contracts were like 60, 80 million, something ridiculous, right? Actually, he might even sign a big mega deal recently, but regardless, this guy makes tens of millions of dollars every year, and there's nothing you can do other than ventilate them. So recognize that just because you have money, just because you have health insurance, just because you are young and healthy currently, doesn't mean you won't be affected by this, and doesn't mean you shouldn't care, you shouldn't be aware of what's going to happen, because we will need ventilators. And if we're bogged down with ventilators because you characters can't stay home, that's a problem. All right, so that's all I got to say about this. I hope everyone has a great day. I also want to end this by saying, like, I'm trying to minimize this, at the same time preach the seriousness of it. I don't want everyone to be depressed. I don't want everyone to be distressed. That's not what we should be doing. Everyone should be relaxed. Everyone should be calm. But at the same time, it is important to recognize that if we don't take it seriously and follow medical science recommendations, we're going to run into issues where it is a situation that is very stressful, that is very life and death. So for all of you guys, recognize, don't be a panic, don't be out here hoarding, but instead do the little things. Stay home, wash your hands, right? Help us help you. All right, so everyone have a great day. I'm Dr. Pinesett. You guys always on the website, studenttransformation.com, and if it's your first time with me, subscribe. We don't normally talk about stuff like this, but I thought today was important as an anesthesiologist to bring some information about this so people don't start freaking out right off the bat, and understanding that, yes, respiratory failure is our big concern with coronavirus. You're going to see a lot of cases like this. So everyone, have a great day. See you guys next time.
Today is the day, guys. No more excuses, no more complaining. You're going to take your future in your own hands. You're going to dominate. You're going to be successful. Get to my website, studenttransformation.com. I challenge you. What are you going to do today?